And welcome back to Holistic Healthline, your direct line to great health. And we are so thrilled today to have as a guest Dr. Kate Rheaume. She is an author, naturopathic doctor, a graduate and former faculty member of the Canadian College of Naturopathic Medicine. Dr. Kate lectures internationally on many topics related to health and wellness and is a frequent guest on radio and television across North America. She is also the author of the best-selling book Vitamin K2 and the Calcium Paradox, How a Little-Known Vitamin Could Save Your Life. And we are so happy to have you on the show, Dr. Kate.
Good morning. I'm really happy to be back.
Dr. Kate, we see patients for every type of condition, health condition that you can think of, but probably the most predominant right now is stress and anxiety. Both men and women, all ages. What's going on?
That's a great question as to what's going on. Obviously, there's different things going on, and it's multifactorial. Stress is a contributor and an exacerbating element to almost any condition that you can think of. And stress causes us to produce inflammatory compounds the same way we would with any other kind of, say, infection or injury, that kind of thing. And so that's the mechanism by which it can make any condition worse. But the anxiety seems to be reaching epidemic levels, and that is a little bit harder to pinpoint. There definitely do seem to be several factors. Our nutrition has changed in a way that we are lacking, certain nutrients that can affect that on a number of levels, as well as we're in an interesting place in the world right now, and that's affecting people.
Yeah, worldwide, I think.
Worldwide, it's a global phenomenon.
And with the internet and social media and all the things, ways of people communicating with each other, it's like you hear things instantaneously that you may not have been able to find out until, 2 or 3 weeks later. Now it's moment to moment, and it just seems like, I don't know, you look at television or anything, everything's breaking news. Everything's, oh, my God, and then, just trying to, I think, get along in life, and the number of health problems also increases stress levels in our lives.
And that stress must be affecting us, aside from the, emotionally, it's got to be affecting us physically too.
Absolutely. I mean, when we're aware of stress, and we often are aware of feeling stress, for example, that's one thing. And yet, even when there's sort of a low level of stress that's there that we either become accustomed to or we may not notice as much, our body is producing stress hormones in response to this. More cortisol than we should, for example, or at the wrong times of day than we should. And that can interfere with our ability to focus and concentrate, our ability to sleep, to either get to sleep or stay asleep. And so that affects overall well-being in ways that can vary from either subtle to really obvious.
I think some people are aware of like the thyroid and the pancreas and, other glands in the body that regulate hormones. But as far as the stress aspect, which part of the body is kind of regulating that?
Well, it starts with the brain, of course, and so things that are stressful, it's not as much what happens to us as what we think about what happens to us, and that's an important thing to keep in mind when it comes to stress. It starts with the brain, and then depending on how we interpret whatever is going on, the brain will send a message to our adrenal glands to cause them to produce adrenaline and cortisol and these other fight or flight hormones, these stress hormones that are preparing us to protect us from this stressor. And in small amounts, that's a good thing. Stress is the spice of life, and we need that in appropriate amounts. But in larger amounts, those hormones that are supposed to help us start to work against us. High levels of cortisol, for example, will encourage us to gain weight, and especially abdominal fat. That will just it's a protective mechanism. That hormone causes us to pack on the pounds there, and it can interfere with our sleep, for example, because it decreases our melatonin level. So those are ways in which those hormones, again, which in appropriate amounts will be helpful, will start to turn harmful.
I don't think in conventional medicine the adrenals are paid attention to much, but what are the natural ways that we can help these adrenals to balance out? And
that's a great point. I think in conventional medicine, there's a thinking that your adrenals are working perfectly or not at all, and there's nothing in between. But of course, like any other organ in the body, there's a range of function for the adrenal glands, and the concept of adrenal fatigue, or your adrenal glands, not having a diagnosable condition in the conventional sense, but not working as well as they should, has sort of been dismissed. And yet I absolutely see this day in, day out. And the good news is there are things we can do to help our adrenal glands do their job better. They need certain nutrients, for example, to do their job in making these hormones appropriately. Vitamin C, it's a very simple thing. Magnesium is another one. Vitamin B5, or just a good B complex in general, but B5 is a special nutrient. So as a first step, providing the adrenal glands with the nutrients they need. Magnesium is another one. And there are also special herbs, so botanical medicines, plant-based medicines that Mother Nature provides to us that will work to help the adrenal glands do their job better, and that can make such a difference with overall physical and emotional well-being.
Now, the medical profession, conventional medical profession, tends to poo-poo the idea of adrenal fatigue. But people definitely have symptoms that you go, oh, yeah, that's adrenal fatigue. What are your thoughts on that?
Yeah, it's perplexing, but yeah, like I was saying, that there's this concept that your adrenal glands, conventionally either are working perfectly or not at all. When they're working not at all, there are a couple of conditions that can happen, with your adrenal glands. But it's like any other organ, your heart, your kidneys, you name it, there is a range of function in between working perfectly and not at all. And if we can be proactive, recognize some of the signs and symptoms of this adrenal fatigue, so this suboptimal functioning of our adrenal glands, then we can really make a difference in day-to-day well-being.
You said before, basic nutrients, magnesium, vitamin C, that kind of thing. I would think even basic things like good sleep would be crucial.
Good sleep, of course, is crucial to the functioning of the adrenal glands. There's no doubt we need that rest for a number of reasons, and then that helps to set our daily rhythm because, we talk about high cortisol levels or low cortisol levels. Mostly we talk about high, but they're supposed to vary throughout the day, be high in the morning and be low at night. And one of the signs and symptoms we have with poor adrenal function is that rhythm is off, and you're not producing the right amount of cortisol at the right time of day. And yes, sleep is important, but the chicken and an egg scenario is sometimes our sleep is affected by poor adrenal gland function. We are producing too much cortisol at the end of the day. That's leaving us tired and wired, and we're not sleeping well. And so sometimes just the adrenal support, herbs, for example, or those nutrients, will help us sleep better, which in turn helps the adrenals again. So that's a positive cycle.
Could that be a factor why some people will say, I can get to sleep, but I'll wake up at like 2 o'clock in the morning and then I can't get back to sleep? Are the adrenals potentially a factor in that?
Very much so. And often they'll say it's more around 3 o'clock, and that is a very common time. It's a special time for people to be waking up and feeling quite wide awake. And that is often due to an inappropriate production of adrenaline in the middle of the night. Now, there's a couple of factors involved here, but the adrenal glands overproducing adrenaline at the wrong time of day is a big one. And occasionally I hear from people who wake up in the middle of the night with heart palpitations. Their heart is pounding. And they've been to cardiologists and all around the block, and can't figure out what's going on. And it's not a true cardiac problem. It's just that their adrenal glands are pumping out adrenaline in the middle of the night when they really should be resting. And so this is another area where taking care of your adrenal glands can make a big difference, is this 3 o'clock type of insomnia.
We're going to take a quick break, and when we get back, Dr. Kate, want to talk a little bit about some supplementation that could potentially help people with some of the stress reactions that they're having, but also to help them with sleep so that they don't have to do some of the medications that the doctors are prescribing for sleep. We're going to take a quick break. You're listening to Holistic Healthline, your direct line to great health. And welcome back to Holistic Healthline, and our guest, Dr. Kate Rheaume, naturopathic doctor. Dr. Kate, one of the formulas that we utilize that works really well by natural factors is a product called Tranquil Sleep, and I believe you're familiar with it. And can you tell us, why does it work so good?
I'm familiar with this. I've used it myself. My family, friends, and patients have used this over the years. It's a very simple, elegant, and yet effective formula that contains it's 3 ingredients that help with getting to sleep and staying asleep and waking up feeling refreshed. And so the 3 ingredients are L-theanine, which is an amino acid from green tea, which does not cause drowsiness per se, but it helps to calm your mind down, so that overactive mind at night when you're lying there and can't stop thinking, to calm that down. And then a small amount of melatonin. Melatonin has its place in sleep, and it is, of course, the famous sleep hormone, and many people are low in that for a number of reasons, as we were saying. High cortisol levels, too much screen exposure, especially late in the day. And then the third ingredient is 5-HTP, again in relatively small amounts, but this helps your body make its own melatonin. And so it's a really nice combination, again, to help you get to sleep, stay asleep, and not wake up feeling groggy or hungover.
Can anybody use it?
Because it has an extremely small amount of 5-HTP, it is technically contraindicated for people who are taking SSRI-type antidepressants. But everybody else, it is a extremely safe nutrient. I've had my own kids, for example, when they had trouble sleeping for whatever reason, have taken this. And it is an all-around safe product, yeah.
And again, we're talking about the Tranquil Sleep by Natural Factors. We've been using it for a long time in our practice, and it's really popular. We've had numerous people come in and purchase it for a bunch of friends, and then the friends tell the friends, and so it's a great product that doesn't leave you feeling that hungover thing in the morning that some of the over-the-counter sleeping supplements can. Also, you mentioned theanine in the Tranquil Sleep, but Natural Factors also makes a called sun-theanine formula that can be taken during the daytime as well.
That's right. So the theanine in the Tranquil Sleep is combined with melatonin, so of course you should only take this at nighttime or bedtime. But you can get the L-theanine on its own. And on its own, this can be taken at any time during the day or night. Again, it doesn't cause drowsiness. You could take this and operate heavy machinery, for example, and it will calm the mind down. And so if you're feeling anxious, you can't seem to control your thoughts, it's a wonderful way to calm and focus the mind. And so I have taken this if I want to sit down and write an article and be focused, or even do an interview. So if you're feeling noticeably anxious, taking one of these capsules or chewable tablets will produce a sense of calm quite quickly. And again, it's not habit forming, it has no drug interactions, and it just provides a very subtle, noticeable calming effect.
We have found with children who have trouble paying attention in school.
A lot of people in business that nurses and teachers that are multitaskers but need to be on point and be able to focus on doing presentations or just paying attention to what's going on, that it helps them to focus better and again kind of take down that thought kind of thing going on. Sun-theanine
helps to produce alpha brain waves, and these are the brain waves that are characteristic when we're calm and focused, like a meditative state. And so, you're in the zone, and you can quiet down those overactive thoughts that you can have, and it really works nicely for that.
And I mentioned it, we use it with children, but very often parents who are not as familiar with natural medicine are very apprehensive about giving their child something on a daily basis. For a kid, theanine regularly, is that going to be a problem?
It's very safe. You can think of it as having a nutrient, like a nutrient that could be coming from the diet. You know, in some countries where adults and kids may be drinking green tea on a daily basis, they'd be getting this in to their diet in that way. Extremely safe. Like I said, no drug interactions. No, I don't even know what the toxic limit is. It is very, very safe.
We even use it with our miniature dachshund, who gets a little uptight sometimes and traveling and stuff like that, and she just mellows right out.
I bet.
Yeah. And also, Pharma GABA. GABA is a nutrient that we found very helpful for people who want to feel more balanced.
Yeah, so this is a nutrient. It's another amino acid that is related to L-theanine. They're sort of biochemical cousins, I guess you could say, but they work just a little bit differently. And I would say GABA is a little bit stronger than the sun-theanine, although some people just have a personal preference for one or the other. And it is a nutrient that you can take for people who are feeling anxious or who tend to suffer with anxiety and panic attacks. I have used that and seen it used for individuals for this way. Or it is bedtime and they can't calm their mind down, or they tend to wake up every 2 hours with this overly busy mind. The GABA is the brain's primary calming neurotransmitter. It stands for gamma-aminobutyric acid. And it just, again, calms and focuses and balances, I think, is a great way to put it.
We've also found it to be beneficial in our practice for patients who have neuropathy, to help tone down the pain receptors. Have you found that to be helpful too?
Yeah, that in combination with B vitamins, the B complex or even individual Bs can be very helpful. And yes, exactly that overstimulation of the nervous system that can be, getting the pain receptors overactive, the GABA can help calm that down.
It seems a lot of our patients, when we're dealing with stress, anxiety issues, they want to just take these things when they're feeling stressed. Is that? I always tell them I want to almost train the system to stay relaxed more consistently.
Well, the nice thing about these is if you want to, you can just take them when you're feeling stressed, and they are effective in that way. However, I agree it to just tone down the overall overactivation of that sympathetic or stressed out part of the nervous system on a daily basis. I think there's a merit to that and usefulness to that. And however, if people are feeling day in, day out that they're reaching for this constantly, wonderful way to calm yourself down for a few hours and then you may get back to your baseline or feel calmer afterwards. Then there's the Serenity Formula, which is a combination of adaptogen herbs, which on a daily basis and over time, again, help tone the adrenal glands and support them so they are, acting appropriately and not overproducing the stress hormones when they shouldn't be.
Adaptogenic herbs. Now, for the listeners, what is that? What does
that mean?
These are herbs that help us adapt to or cope with stress, and so help our adrenal glands do their job better in producing the right amount of stress hormones when we want and need them, and not when we don't.
So again, a balancing agent.
Yes, exactly.
And we've seen a rise in autoimmune conditions, and often related to chronic stress reactions over a period of time. Would taking these type of formulas be helpful?
Yes, so exactly. When we're under stress, as I was saying early on, our body will produce inflammatory compounds. This will activate the immune system or overactivate the immune system, and so this can exacerbate things like autoimmune conditions. And so if we can tone down the stress response, we're toning down that inappropriate activation of the immune system.
And is there a way for people to find out more information about you or also Natural Factors products?
Sure. The products we've been talking about today, there's more information at www.naturalfactors.com, and people can reach me at www.drkateND for naturopathicdoctor.com.
Okay, well, thank you so much. It's so great talking to you again, and we hope to talk to you again in the future.
Me too. Thanks. Always a pleasure.
Have a great day.
Take care.
And Dr. Kate, we love her. She's great. She keeps us well informed, and she's written numerous books. Yeah. So, check her out because she is the woman in the know, particularly about women's health issues. Not as much has been written about women's health, and she has been a key person in particularly how stress affects women's health.